everybody, this is Tess with Rowe Dental Lab. I'm here with Dr. Burke at Westermeier Martin. Dr. Burke, why don't you start off by telling us a little bit about the practice?
So we are located in the Buffalo, New York area, and we are a fee-for-service general dental practice with a focus on implants and full arch.
Great, and so Dr. Burke's been doing quite a bit of CHROME with us. What were your expectations going into your first case with Rowe?
So I was looking for a fully guided surgical and prosthetic workflow that was the best, and that brought me to Rowe. And my expectations were very high, and they were certainly met.
Great, and what do you feel differentiates CHROME from other guided systems that you've used in the past, or what stuck out to you when using it?
So it's a very simple system when using it. It's very, kind of straightforward, well thought through, but super accurate and super stable. And I'm always amazed when I do a case, the time savings and the accuracy that's provided with the CHROME guided system.
And how much did you love the rapid appliance when it came to the patient's next few appointments after the initial surgery?
So that's one thing I was really impressed with, was the simplicity with the rapid appliance and how many restorative steps are saved by using the rapid appliance, and the patients really like not having all these impressions and things done. They're really amazed when we use the rapid appliance for their final, how easy that appointment is and how quickly we can get to their final step after the implants are integrated.
Do you feel the team at Rowe offers sufficient support when it comes to collaborating and planning these cases with your team?
So I have a point person at Rowe that I go through with any questions or changes that we have to do with our cases, and I find that to be extremely efficient, and I can really rely on my tech at Rowe to make sure these cases go smoothly, because so much goes into these cases in planning and execution that it's really great to know I have one person that I can call and they know everything about all the cases that I have going on.
We love to hear it, and we look forward to working with you more, Dr. Burke.
Thank you so much.